Hi, I'm Doc Migs. You can simply call me Migs. For today's topic, I'll be discussing transgender health, but I'll be focusing more on putting it under the HIV primary care perspective. So I'm sure, or ang alam ko, no, karamihan ng umaattend ng HTTP are HIV primary care providers as well. And from experience, for me, nakikita ko mas madaling mag-provide ng transgender health kasabay ng HIV primary care services, no? So we can discuss transgender health if we do have basic concepts. And it's good na lahat tayo aware na tayo with GSC. I'll be discussing or pahapyaw kong itatakal yung gender dysphoria, concepts about transitioning or gender affirmation. And it's also good to have a background on evolution of the trans health recognition para maintindihan din natin ano yung mga issues or impact nito sa community natin, no? And how to further approach transgender health wherein our clients or our patients will have better access. And then of course, yung pinaka-hinahabol ng karamihan ng ating mga kliyente, yung hormone therapy. And since HIV primary care ang ating perspective, I'll be also discussing yung drug-drug interaction with antiretroviral therapies. So hopefully, kayanin ko in 30 minutes. Okay. So for clinical case, I prepared 2, but I'll let you choose kung alin yung gusto nyong itackle further later. So for case 1, we have a transgender woman who was recently diagnosed with HIV. And we have a case, second case, a transgender man who wants to access PrEP or pre-exposure prophylaxis. So sabi ko nga, no, for me, mas madali yung mag-provide ng transgender health using the HIV primary care approach. Kasi doon ako nagsimula. No? So as mentioned ni Sir Rad kanina, magkakasama kami nung unang nilaunch yung gender sensitivity workshop together with Doc Kate as well. No? So nilagay ko yung mga natutunan ko from that GSE sensitization workshop, in-incorporate ko yung mga learnings ko or skills ko na natutunan ko as a volunteer HIV counselor and HIV life coach. So as always, we provide a safe space for our clients. So for transgender people, pinaigting ko yung aming transgender health services by making it a safe space. So yung clinical facade, yung mismong location, no? Yung physical office, yung physical clinic, must be welcoming for the transgender community. And then in terms of para iparamdam kong naaalagaan ko sa sila, we provided mga client-centered interventions. So beyond sa HIV services, we also started with at least yung primary care approach for trans health. And then of course, para mas maramdaman nilang naaasikaso sila, we also expand our services. In-incorporate na rin natin yung differentiated service delivery. So in case na wala ako nung specific service na hinahanap nila or yung specific na intervention, at least man lang ma-refer ko sila sa kung saan nila ma-access yun. Okay? Yan. So we uphold yung iniingatan, inaalagaan, at inaasikaso experience for our clients. Ano na lang, no? So mapapansin nyo, madalas ginagamit kong word is client rather than patients. Dahil karamihan ng mga kliyente or yung mga taong nag-access ng services ko, hindi naman lahat may sakit. Especially for the transgender community. Okay? Yan. So, I'll give you a background kung paano nga ba na-develop yung transgender health at bakit issue ito sa ating current society. Okay? Yan. So, ang transgender health has been in existence since in the early 1900s. No? So, it was developed by pioneers such as Alfred Kinsey, Harry Benjamin. Sila yung mga unang nag-develop ng mga iba't ibang surgical procedures, hormone therapy, and they also explored further yung mga, initially nakita nila to as they recognize transgender health concerns under mental and psychological disorders. Okay? Yeah. So ang kagandahan ng mga health recognition na ito is naipapasok siya in terms of healthcare system. So yun nga lang, for someone to access an intervention or treatment, they have to be diagnosed. No? And unfortunately, it started with a mental health disorder. So as early as 1960s, it was diagnosed as, or they recognized transgender health concerns as a sexual deviation And then in the 1980s, DSM-3 by the American Psychological Association released yung gender identity disorder. And then until nitong 1990s, pumasok sa ICD-10 yung gender identity disorder. Ang benefit naman nito, especially with DSM-5 noong 2010, na-recognize under the US Health Insurance ang gender dysphoria, therefore providing access or healthcare access for transgender people. Yun nga lang, may kaakibat itong cons, no? And then in 2018, WHO redefined gender identity disorder and reclassified it under the sexual health chapter. So magandang move ito kasi tinanggal na nila under the mental illness definition ang gender identity health concerns. Okay? So ano nga ba yung gender dysphoria? Karamihan ng mga clients natin, no, or mga transgender people would come to us accessing healthcare para daw sa kanilang gender dysphoria. So basically, ito yung discomfort or distress or the discontent that a transgender person experiences with the discrepancy of their perceived or their experienced gender with their assigned sex at birth. No? And then of course, kaakibat nito yung mga associated gender roles or even yung mga taglay nilang sexual characteristics. So ito yung usually nag-urge or nagpo-push for a transgender person to further access yung mga hormone therapy or even surgical interventions to help alleviate yung dysphoria. However, it must be taken note that not all transgender person experiences dysphoria. No? Especially sa nakikita ko, I had a client na wala siyang any sense of minority stress. Kasi since nung childhood niya, he was able to be to fully express yung gender niya with the support of family and even yung community. So mula sa school hanggang sa paglaki niya, even sa workplace, no? Never na-feel yung na-discriminate or na ano siya, kinahiya niya yung kanyang transitioning, no? So again, not all transgender people will experience this, and some gender non-conforming individuals may also experience this at some point in their lives. So furthermore, na-develop further yung sa ICD-11, no? It has already redefined yung gender identity disorder into gender identity related health. So yung dating mga definition or mga dating diagnosis such as transsexualism, gender identity disorder in the young adult or in childhood, they were redefined into gender incongruence of adolescence and adulthood and gender incongruence of childhood respectively. And they were all moved under the conditions related to sexual health chapter. So since 2018, no, and netong ICD-11 nga, released in 2021, gender identity or gender incongruence is no longer a mental illness. Okay, so hopefully lahat tayo na magkasundo tayo with that. Na ito ay isang concern or condition related na to sexual health, which further gives access or parang mas napapaigting or napapalawak na lahat ng tao should have access to such health care. So ano bang benefit ng redefinition na to or ano bang anong significance nito? So one, hindi na nga siya mental ill health. Okay? This would also further ensure access for transgender people to gender-affirming healthcare. And of course, may health insurance coverage. So sa practice ko, nakikita ko to mostly sa mga US-based and yung mga foreign insurance companies nagko-cover talaga sila. No? And then this would also acknowledge the link between gender identity, sexual behavior, exposure to violence, and sexually transmitted infections. So papasok ngayon dito yung differentiated service. So yung consensus ng World Professional Association for Transgender Health back in 2010 that being transgender is a matter of diversity and not a pathology. Kahapon ko lang na-realize to, no, habang nire-review ko yung slide ko na parang it took about a decade, no, na to further na talagang makamit natin to, no, yung statement na it's not a matter of pathology, no, with the redefinition ng ICD-11 and ng WHO. Okay? So to be clear, being a transgender is not an illness, it's a matter of diversity. Hence, walang kailangang gamutin or i-treat, but we provide healthcare services na kakailanganin nila. So bakit importante ito? No? Bakit ito yung inintro ko agad sa Transhealth? Because psychopathologization of gender identity health issues, this would allow trans people to be seen as a person and not as an illness. Hence, they will be provided access to healthcare and not have their rights limited. No? So kasi nga, for someone to access gender-affirming healthcare before, they have to be diagnosed. Dadaan pa sila sa rigorous process of a psychological assessment just to fulfill certain criteria and saka lang sila papayagang mag-access ng healthcare. Dahil doon, mas lumalayo ngayon yung trans person sa healthcare system. So they would eventually self-medicate. Okay? So para ma-address natin yon, we have to de-psychopathologize ang issue na ito. Okay? And also, part ng de-psychopathologization is yung hindi natin dapat ina-assume na a trans person or ang isang tao ay malalaman lang na or kikilalanin lang na transgender once na sila ay nag-pursue na ng any medical intervention such as hormone or yung surgeries. So kaya yung sa pretest, no, nilagay ko talaga doon na a person is considered as a transgender once na siya ay self-determined. No, yung mismong tao ang nakapag-realize or yun yung na-experience ng isang tao, and it doesn't have to be na ay pag nakapag-hormones na or kapag operada na. Yeah. So a way to de-psychopathologize transgender health issues is through by using a different model or a different model of care approach. No? So ang sa nakikita ko as of now, ang pinaka-applicable would be the informed consent approach. So with informed consent, this basically honors yung cognitive capacity ng isang individual to make decisions for themselves in terms of their health care. So this seeks to acknowledge and better support the patient's right to and capability for choosing their care options. So may personal autonomy. Ina-uphold natin yung bodily autonomy nila. Okay? So with informed consent, as long as the person has the cognitive capacities and cognitive abilities to decide for themselves, acknowledging then yung mga risk and benefits of the services, a mental health assessment with a psychiatrist is not mandatory. Okay? Na kailangan dumaan pa siya sa psych before ako mag-start ng hormones. Hindi na. Okay? So yung cognitive capacity naman and cognitive ability, masusukat naman dito or makikita naman to even with a simple yung face-to-face na consultation, no? Even with a primary care physician. Okay? So anong benefit with this informed consent approach? Hindi lang para sa mga kliyente natin to. It would also enable us, the providers, to attain a richer understanding of transgender and gender non-conforming people and to deliver better patient care or client care in general. Okay? So, two-way street ito. Magbe-benefit yung ating mga kliyente, magbe-benefit din tayo as provider kasi lumalawak yung ating kaalaman. No? And ang setup naman ng informed consent is hindi ito parang gatekeeping na yung doktor or yung medical provider ang magdidikta ano ang pwede, anong hindi. It's more of partners in health tayo, no? Side by side tayo with the clients or with the patients. Now, we offer them the options, nilalatag natin both benefit and risk. Then we allow them to decide, no? Alin yung mas nakikita nilang akma for them or alin saan sila mas magiging masaya or basically mas ma-achieve nila yung goals nila. Okay? Okay. So as primary care provider, since sa clinic ko, mostly pumupunta na sa akin are transgender and gender diverse people, I help them explore issues of their gender identity, Yung iba questioning pa. So minsan tinutulungan ko lang silang ma-realize further. Ano nga ba talaga yung nakikita nila sa sarili nila and ano yung mga gusto nilang i-pursue in terms of gender affirmation. Then I would conduct initial assessment. If ever wala sa akin yung service or nakikita kong may iba pa silang kailangan, I have to provide appropriate referrals. Okay? And then of course, discuss the pros and cons of each intervention. If may mga ma-assess naman na other comorbidities, I should be able to manage such health issues. And of course, provide preventative care. Okay? So very differentiated service dapat in terms of primary care. Okay? So later on, gagamitin din natin to dun sa ating mga cases. So ano nga ba yung gender affirmation? No? It's basically when an individual is already recognized in their experienced gender. So may iba't iba itong aspeto, mostly yung 4, personal, psychological, legal, and medical. So itong 4 na to may not be all at once. Yung iba, nauuna sa kanila yung psychological. Yung iba, nauuna sa kanila yung social or personal. And then yung iba, inuuna agad medical. No? Ang pinakamahirap ma-achieve as of this time is yung legal. No? So in terms of personal and social, dito nagsa-start yung pagpili nila ng kanilang chosen name. No? So kunyari, ako Miguel. In case na mas comfortable ako na matawag as Michelle. No? Example lang po yon. No? And in terms of preferred pronouns, pag nagpapakilala sila. No? So as you can see rin, mostly sa mga Zoom meetings or sa mga virtual webinars, makikita nyo na yung iba naglalagay na ng pronouns sa tabi ng kanilang names. No? It's a good practice, no, to also influence or make other people aware of such practice na mas nagiging gender sensitive yung mga tao. Okay? And then of course, meron yung mga non-medical physical methods. Nilagay ko non-medical physical methods kasi ito yung mga nagagamit nilang tools such as chest binders for trans men to make their chest contours flat. And then for women naman, trans women, they use yung talking, no, to make yung kanilang genital contour flat naman. Okay? And may iba't iba pang mga tools na nagagamit ang mga ating transgender brothers and sisters. Then, I'll be focusing more on the medical for today. No? I'll be tackling yung GAT or Gender-Affirming Hormone Therapy and yung Gender-Affirming Surgeries. Pero pahapyaw lang, I will not be discussing the whole surgical process. But at least meron tayong overview. So for a gender-affirming healthcare, no, or para masabi natin na tayo ay competent in terms of transgender health service, we have to be trans-affirmative sa ating pagbibigay ng serbisyo. So trans-affirmative, basically, it has to be inclusive, self-determined, and rights-based. So ina-acknowledge natin or bina-value natin yung ating kliyente sa sentro ng ating serbisyo. Okay? We also have to be trans-competent in terms of providing such care. So ano ba yung mga core competencies na kailangan natin as a transgender health provider? Dalawa po ito. Una dito is yung trans-clinical competency. So ito yung demonstrated competency across the specific gender-affirming healthcare needs. And of course, ito yung general health care, no? Yung primary care. Unfortunately, no, dati no, hindi ito part ng ating medical curriculum, whether sa doctors, sa nurses, medtechs, psychologists, psychiatrists, no? So hindi siya part ng mga sa education or sa school. And then pagdating naman sa residency programs, dati no, naabutan ko hindi pa siya part, hindi nga na-discuss or natatackle. Mostly parang GSC lang din, no? But ngayon may mga efforts na from different medical societies to include yung mga transgender health approaches. No? There's one with OB-GYN Society, with the Endocrinology Society as well, and even yung ating mga kapatid sa psychology and psychiatry. Okay? So may development naman na. Okay? And then of course, aside from the trans-clinical, no, kailangan or importante din yung trans-cultural competency. It is the ability to understand, communicate with, and effectively interact with trans people in a respectful, non-judgmental, compassionate manner and in settings of free of stigma and discrimination. So itong transcultural competency na ito, madedevelop lang natin to outside school, no? Or hindi siya part ng ating conventional na education system. But natututunan ito or nade-develop ito by interacting with trans people. So by simply listening or hearing out yung mga hinaing ng ating mga transgender brothers and sisters, that would at least allow us to have a view of their struggles. So naintindihan natin saan sila nanggagaling. Para nang sa gayon, doon natin malalaman paano natin maipoprovide yung ating services na hindi nila ma-experience ulit yung stigma and discrimination na naranasan nila from a different provider. Okay? So basically, mag-consider nating trans competent ang isang tao if they are able to provide healthcare free of stigma and discrimination. Yun na yung pinaka-summary nito. Okay? So in terms of once na magkikliyente tayo or mamamasyente tayo, no, ng isang transgender person, the typical or the usual pa rin naman in our medical education is yung history taking, review of systems, then review ng past medical history, surgeries, no? Pero dito, ina-incorporate ko lang din yung gender history. So kunyari, gusto kong malaman or gusto kong maintindihan further yung kanilang gender identity. So these are the questions that you may ask. Okay? O pero sa forms ko kasi outright nakalagay na doon, no? May fill outan sila gender identity and then yung sex assigned at birth. So ang ginagamit ko kasi yung two identifiers, no? Na nakikita nyo rin po ito sa ating mga HIV testing forms, no? So kaya po nalagay doon is gender identity and then yung sex assigned at birth. So at least as a provider, may idea tayo, no? If our clients are cisgender, transgender, no, or non-conforming based dun sa sagot nila doon. But kung first time yung ma-encounter or first time yung mamamasyente, it helps, no, to hear them out, no, regarding their gender history. Okay? Sa ganitong paraan na de-develop po yung ating trans cultural competency. Then aside from their gender identity, of course, in gender expressions, these are some key questions that you can use. Okay? Then, of course, you will be able to assess pa rin for gender dysphoria, at least man lang at kahit man lang superficial, no? You can simply ask them how they felt or how they feel about their transitioning, no? What urged them to pursue their transition, okay? Or yung paglapit sa atin for their gender-affirming care. Okay? And then, we elicit sexual history. So, nagiging particular din ako with their sexual activities. No? Later on, I'll be showing din sa case natin kung bakit important ito. So in terms of yung acknowledged link nga ng sexual behavior and risk for STIs, dito papasok yung pag-elicit ng sexual history. Okay? Then of course, for medical and surgical history, importanteng lagi na alam natin yung anatomy that is present. However, not all transgender person will be comfortable to divulge agad yung mga ganitong information. Kumbaga, yung iba have already undergone the surgery nga para nga hindi sila ma-clock or hindi sila ma-call out na sila ay transgender. No? Yun nga yung pinursu nila. No? Nag-undergo sila ng mga complicated na surgeries nito para hindi sila ma-identify by their assigned sex at birth. So kaya hindi comfortable yung iba na mag-disclose agad na sila yung nag-undergo na ng operations. So it will take some trust and established rapport for this to be elicited, no? Pero sa case ko kasi since transgender clinic yung akin, outright sila na mismo agad nagsasabi nito. Then of course, when we conduct physical exam, especially kung need for a genital exam, we only do this if necessary, especially kung ang concern or ang complaint is STI, no? But kahit na STIs ito or sexually transmitted infections at need ng physical exam, hindi natin sila pipilitin. Una, we have to explain to them step by step paano gagawin yung genital exam, ano yung benefit nito, anong makukuha kong information, at kung yung information ba na ito hindi ko makukuha with any other procedure. Okay? So we have to use gender-affirming language. Later on, I'll show a list. Okay? And then we have to ask patients, no, for what words do they prefer to use for their anatomy. So mas madali to kung you allow them to describe na lang muna. So kung sabihin nila yung kwan ko sa harap ng kwan, minsan sinusundan ko lang, so yung kwan po. Pero pag medyo mahirap na kailangan ko ng specific anatomy, I'll have to ask na, alin po dun sa mga kwan sa baba. Okay? So yung iba hindi komportable talagang ma-mention yung penis, vagina, even yung breast. So you can use yung chest or yung dibdib. Sa Tagalog or sa Filipino naman, mas madali. Gender neutral naman mostly yung mga body parts natin or body terms. So these are some examples. So you can try this. It takes some time, no, para masanay gamitin yung mga ganito. Mostly English-based, but you can try with your own languages, no, especially yung mga from different regions. So it's important to keep an anatomical census. Basically, inventory siya ng mga organs. Kasi baka nga yung iba sa kanila already undergone natanggal na nila yung scrotum, yung prostate, yung testes. So wala nang point para magpa-prostate exam. Okay? And then yung iba naman have already undergone mastectomy. Still, you'll have to consider doing a breast exam as per recommendation pa rin ng societies. Okay? So for the gender-affirming healthcare, gender-affirming hormone therapy, okay? Ang goals naman nito, ang objective nito is to ensure medically appropriate yung hormone levels na gagamitin nila and to prescribe accurate hormone regimens. But unfortunately nga, as mentioned dun sa early video, no, mostly nag-a-access sila ng sarili nila through Shopee, Lazada, and even sa TikTok. No? So kailangan natin maka-keep up na we have to be able to supervise their medical transitioning. Okay, so prior initiating hormones, hindi naman to basta-basta reseta then inom agad, no? Kailangan muna nating malaman ano ba yung goal ng kliyente, para saan yung gagamitin niyang hormones. Kasi baka mamaya, hindi naman true hormone therapy yon. Okay? And then we have to evaluate medical conditions, especially kung may hormone imbalances, may mga existing comorbidities. And then we have to ensure hormone levels are in the normal physiologic range of their targeted gender. Okay? So ito yung sa part ng monitoring. Considerations for hormone therapy, kailangan effective, safe, with a minimal side effect, and of course, accessible. Challenge dito is yung accessibility since mostly nga hindi FDA approved for gender-affirming therapy, but approved for hormone replacement therapy. Okay? So part nung sa safety, no? We also teach them how to perform intramuscular injection. Ito very helpful tong YouTube video na to, especially during the pandemic, nung kasagsagan nung quarantines. No? So hindi ko sila mapapunta sa clinic para ma-injectionan, so I have to teach them. So maliban sa virtual na assisting, binigyan ko sila ng video. Ang kagandahan nitong link na pinili ko is meron din siyang in text. So always provide video with text instructions. Okay? And preferably dun sa language na naintindihan nila. If hindi nila naintindihan English, you have to translate it for them. Okay? So for transgender women, basically ang goal is to increase estrogen, no? And to decrease yung testosterone hormones nila sa katawan to produce a more feminine sexual characteristic. Ito yung mga different regimens na pwedeng gamitin: estrogens, anti-androgens, and progestogens. In terms of recommendation, paano yung combinations? So may magkakaibang recommendation ang iba't ibang societies. But from the WPAT, Standards of Care, version 7, they only recommend estrogen and androgen blockers. Kasi for progesterone, wala pang nakikitang, or in terms of studies, no, limited pa yung studies that show significant yung impact ng progesterone use. Okay? So you leave it, I leave it to the clients after giving them the different recommendations. So kung gusto pa rin nilang gamitin, kasi iba yung na-experience nila. So yung iba sinasabi, it helps with the mood. So if it helps with the mood, I allow them to use it. But syempre, I taper yung dosing. Okay? These are the different dosing regimens. Okay? Ang challenge with transgender women is masyadong madaming regimens available. And these can be used in different combinations. So marami na akong nakitang iba't ibang combination na ginagamit ng mga transgender women. Okay? So ang pinaka-role ko is to monitor, basically for side effects, and to help them taper kung may need i-taper sa mga dosing. So ito yung mga locally available. Ito rin yung mga recommended based sa mga standards of care. However, ito rin yung pinaka hindi ina-access, no? Kasi yung iba dito mahal or limited yung stocks availability. Yan. The recommended anti-androgens. And ito yung madalas ginagamit ng ating mga kliyente, no? Yung mga lady, Yasmin, Dayan, yung mga pangalang babae. However, this is the least recommended because of the ethinyl estradiol. Dahil din sa kanyang risk of thromboembolism. Okay. For transgender men, baliktad naman yung ating goal, itaas yung testosterone by injecting or by incorporating exogenous testosterone. So manggagaling sa labas talaga since assigned female at birth cannot produce their own testosterone. Okay? So ito yung iba't ibang recommended na regimens for trans men. Mostly injectable ang accessible. As for the transdermal, wala pa akong nakita sa Philippines nito. Wala rin ako nakitang gumagamit nito sa Pilipinas since mahal siya and mostly sa mga European countries siya na-access. For Victoria, ito yung dinevelop kong regimen, dosing regimen, especially for gut naive, yung first time gagamit pa lang ng hormones. Ang reason nito is at least natitaper ko yung risk of yung increase yung polycythemia, nililimit ko siya by starting with middle doses and then gradually increasing it based din dun sa kanilang monitoring test. So ito yung iba't ibang masculinizing and feminizing effects. Nandito nakasaad, basically magkahalo na, no? So yung first part is yung sa testosterone-based regimen for trans men. And then for trans women naman yung estrogen-based regimens. So ito yung mga expected na changes. Some of which are yung gusto nung inaasam nila, pero yung iba dito hindi nila inaasam. So for example, yung scalp or hair loss, hindi lahat ng trans men gusto ito. Pero for some, yun yung masculine part for them, no? So, kaya nila pinopursue. For trans women naman, hindi nila gusto mostly yung sa pag-gain ng weight, yung excessive gain ng weight, no? Well, part din kasi yun ng redistribution of body fat. So, ang lagi ko na lang sinasabi sa kanila, hindi lahat ng yung inaasam lang na effects ang magde-develop. Hindi natin kontrolado kung alin dito ang ma-achieve nila. But, ang role ko rin naman din is to syempre, guide them sa paggamit ng hormones. Then, if ever may mag-develop na hindi nila gusto, yun yung i-address natin as it comes along. Okay? Yan. So, leveling of expectation is very important for hormone therapy. Then, the different risks associated with hormone therapy. So, yung bolded items na lang are the clinically significant. So, likely increased risk for thromboembolism and infertility. And then, of course, polycythemia then for trans men then. You can read this further with the standards of care for version 8. I can also send a copy naman to Sir Rad para ma-share din sa inyo. So in terms of monitoring, so kung titingnan nyo, medyo similar din siya with the monitoring test ng ating HIV primary care. Dinagdagan lang natin ng hormone levels. Okay? So ito yung ginawa ko is tipid pack na ito. Most endocrinologists kasi they have a battery of tests, no? However, hindi afford ng lahat ng kliyente kasi it would take about 10,000 pesos just to monitor, no? So, karamihan ng clients ko are not willing to spend 10,000 just for labs. Mostly, gusto nilang i-allocate yung budget for the hormones itself. So, ito na yung pinaka-basic labs na at least magagamit natin, helpful naman, and kahit pa paano, affordable naman for the clients. So, syempre, kung gumagamit ng hormone, may target tayong mga hormone levels. For trans women, ang goal natin is ma-achieve around 200 picograms per ml yung estradiol levels. And then yung testosterone, hindi natin gustong mag-zero to. Kasi kailangan pa rin nila yon for their bone health. So at least mga nasa 50 nanograms per deciliter is already good. For transgender men, hindi rin magandang sobra yung testosterone. No? So we limit it or at least namomonitor natin yung hormones nila between 350 to 700 nanograms per deciliter. In terms of monitoring, evaluate patients every 3 months, especially in the first year, then pwedeng once or twice a year. So yung mga different tests depende sa kanilang hormones na ginagamit. Okay? But definitely, ang at least ma-monitor for trans men is yung CBC, especially hematocrit or hemoglobin. And then for trans women na gumagamit ng androgen blocker na spironolactone, serum potassium. As for the serum testosterone estradiol, costly gawin siya ng every 3 months. So ako, I settle with at least twice a year, sorry. And then of course, yung pwedeng gawin ng ating kliyente, monitor their body weight, blood pressure, no? Ako sinasama ko rin yung bus line for trans women para nagkaka-idea sila kung gaano lumalaki yung breast size. And then for trans men then, I ask them to measure din yung bus line minsan. Especially yung perceive nila na lumiliit daw. So at least mas nakikita nila objectively kung lumalaki or lumiliit ba talaga. Then for cancer screening routine as recommended with cisgender population, screening for osteoporosis, so conducted lang at age 60 or for those na inconsistent gumamit ng hormone therapy. And then conduct annual breast examinations kahit na nagmastectomy, especially for trans men. Okay? Yan. So recommendations same lang din with cisgender. So basically ang transgender health, naka-ankla pa rin talaga siya with primary care. No? Regardless kung cisgender or transgender, kailangan ma-provide natin yung mga basic or yung primary care na kailangan nila. Okay, so for hormone therapy and ART, so may mga recent studies naman. Basically, ito na lang yung summary. Interactions can be present, however, hindi naman contraindicated. Meaning, hindi mo kailangan ipatigil yung hormone therapy just to start on antiretroviral therapy. Hindi rin kailangan i-stop yung antiretroviral therapy para lang masustain niya yung hormone therapy. Ang nangyayari kasi for trans people, parang nagiging choose one over the other. And karamihan sa kanila, they will choose hormone therapy. Okay? So, no need nang patigilan ng hormones just to start ART. Okay? But the first line na dapat nating pinipili is dolutegravir base or yung TLD. Okay? Okay. Kasi yung efavirenz base tsaka yung nevirapine, bumababa yung plasma estrogen concentrations. No? So ang worry kasi nila, mas aalalahanin nila, Doc, baka maging ineffective yung hormone therapy ko pag pinag-start mo ko ng antiretroviral. So issue to dati. Ngayon hindi na kasi may TLD naman tayo. Okay? So basta transgender woman on hormone therapy, start them with TLD. Okay? As long as walang ibang contraindications for TLD. And then even for PrEP, no? Yun nga lang, we have to take note if transgender women are on hormone therapy kasi mag-iiba yung dosing recommendation. So for PrEP, ang dosing recommendation for assigned female at birth, whether cisgender yon or cisgender woman or transgender men, daily dosing sila. For transgender women at naka-hormone therapy sila, lalo na estrogen or estradiol-based regimens, then they'll have to take it on a daily dosing. For gender-affirming or gender-affirmation surgeries, hindi naman lahat ng transgender person nag-aasam na to. Okay? Yung iba happy na with the simple na naging manipis yung kanilang kutis or naging plump yung kanilang kutis. Nag-develop sila ng breast kahit na small cup lang or cup A lang, cup B. Yung iba, nagre-resort to surgery kapag meron silang specific na goal. So, depende yon, aesthetics man or yung functionality. Okay? So, may iba kasi gusto magkaroon ng genital na panlalaki na magagamit nila kapag umiihi sila ng patayo. O di kaya yung magagamit din nila during their sexual activities, especially para ma-pleasure yung partner. No? So, depende yon sa kung ano yung goal na or yung gustong ma-achieve ng kliyente. So it can be done as a single procedure or it can be done multiple stage. Okay? Kasi nga yung iba very complex, depende dun sa function na tina-target. And definitely highly individualized to, tailored fit for the individual's needs and desired outcome. Currently, meron pa ring recommendation no, kung sino yung, or meron pa ring screening or parang may candidates pa rin who can undergo the surgery agad. No? So, ang purpose nito is to ensure na one, may cognitive capacity and cognitive ability yung tao to proceed with the surgery. So kaya meron pa rin 1 or 2 mental health professional na nire-require to provide a letter of recommendation. Pero hindi ang purpose nito is to hindi lang to parang to get an approval, but also ang role ng mental health professional is to assess yung readiness and then also to provide further psychosocial support kasi syempre it will affect their life, no? Yung changes na to are irreversible. Karamihan ng surgeries are irreversible. So kaya kailangan talaga mabigyan sila ng support. And of course, yung may experience kasi din nila from the community or from their family, workplace, once na nakita yung mga changes na to. Okay? So ito rin yung mga parang criteria for one to undergo gender-affirming surgeries. Yan. So these are the different surgeries Basically, ako ginugroup ko lang sila into head and neck, top surgery or yung sa chest, and then bottom surgeries or yung mga genital procedures. And then meron ding mga additional procedures such as yung mga hair removal. I haven't heard of a uterine transplantation na successful. Penile transplantation, yes, meron na. And then, ayun, pwedeng individual, like kunyari gusto lang niya talaga removal of the breast. May iba gusto removal of the breast with gagawan ng magandang nipple and areola na panlalaki. Then yung iba naman gusto nga yung tatanggalin yung penis but magka-create din ng vaginal canal na magagamit for sexual activities. Okay? So it can be single or multiple state. So since maliit yung table kanina, and so iba-iba at marami pang iba't ibang surgeries. Okay? But again, depende to sa target or sa goal ng isang transgender person. Okay? So going back to our case, okay? So for those na pinili si case 1, Victoria. So further evaluation, basically recently diagnosed lang siya with HIV. Previously negative siya 3 months ago. Currently on ethinyl estradiol for 3 years and has not been experiencing morning erections. Since ang goals lang naman niya is to have a breast development and minimize or lower yung libido. So I think na-achieve naman niya to with the self-medication. Yun nga lang, ethinyl estradiol yung gamit niya. Okay? So no known comorbidity as of this date, non-smoker, non-alcoholic beverage drinker, so healthy living si madam. Okay? Normotensive, however, hindi natin na-assess yung breast kasi tumanggi siya. Okay, so how can we go about that? Later, I'll discuss. And then labs na pertinent naman for this case. So mild anemia with hemoglobin of 12. Based ito sa male parameters na usually nire-release ng mga laboratory. Okay, but we can expect hemoglobin of 12 for women, transgender women on hormone therapy kasi bumababa yung testosterone nila. Okay, and then baseline CD4 mataas naman, sputum PCR for TB is not detected and testosterone levels nasa 3 nanograms per ml. Okay? Ayan. So yung sa total testosterone, that should explain bakit wala na siyang morning erections. So kahit na no need na sa case niya gumamit ng androgen blocker. Kasi even with estrogen or kahit monotherapy with estrogen, it can already lower yung testosterone levels na makakatulong na dun sa mga goals ng ating kliyente. Okay. For those na pinili si case 2, Bricks, transgender man na gustong mag-PrEP. So importante na HIV screening niya is negative at the time of consult. However, nakita nga na meron din siyang bisexual activities. So he still engages with men with penises and meron din siyang sexual partner na cis woman. So unfortunately, meron din siyang yellowish vaginal discharge. So with that, we also have to address that. Okay? Self-medicating na siya with testosterone injections for 6 months. However, meron pa rin siyang spotting or menses. Okay? Mataas yung BP upon the consultation, and other pertinent labs done at the time were Hep B screening and syphilis screening. And of course, yung creatinine na usually ginagawa namin with our baseline PrEP initiation. So for both, okay, ang ating current clinical assessment as follows. So we take note of the comorbidities, okay? And then of course, yung mga current medical issues aside from the hormone therapy. Okay? Yan. So treatment options, meron tayo for both. Okay? So for Victoria, definitely maganda same day ART, makapag-start na. Ang pinili natin, syempre, first line, TLD. Then we have to address yung kanyang hormone therapy. So we can discuss shifting her regimen to estradiol valerate na tablets or pwedeng injectable kung willing siya mag-inject. Okay? And then for the labs, we have to assess yung estradiol levels niya aside dun sa testosterone. Baseline blood chem, iron studies as well kasi may mild anemia based dun sa kanyang hemoglobin. So it's maganda na lang din na mag-iron studies to ensure na walang other causes ng anemia. Okay? Then immunization as preventative care. They have to have booster for Hep B and of course HPV. And then breast maturity scale. Ang ginagamit ko, I provide them a scale for them to answer na may pictures ng breast maturity scale. Then papiliin sila kung ano yung nakikita nila for their current body. Okay, and then of course, follow up in 2 weeks. For case 2 naman, they can still start on PrEP agad, no? And then we have to provide, at least ako, nagpo-provide ako empirical treatment for vaginosis. Kung especially, no, hindi madaling mag-refer to a gynecologist for trans men. Dahil nga, one, posible na hindi maganda yung previous experience niya, or two, hindi talaga siya komportable magpatingin sa baba. Okay? So still, I start them with empirical treatment para at least naman may action na akong nagawa to help alleviate yung discharge. And then I tweak yung kanyang testosterone hormone therapy niya. So instead of once a month, ginawa ko siyang every 2 weeks. Baka kasi yun yung reason bakit pa rin siya nagsa-spotting at 6 months of hormone therapy. And then further lab tests to be done. And we assess for hormone imbalances. CBC definitely need malaman kung may polycythemia. In his case, na maaaring nakaka-aggravate ng hypertension. Okay? Then blood chem, kasi kung talagang hypertensive siya, I will have to start then on antihypertensive medications. Then, of course, since limited ako with gynecologic exam, bibigay ko pa rin sa kanya referral to a gynecologist, preferably yung trans-sensitive na gynecologist. Okay? So mostly sa UP ako nagre-refer, okay? Sa PGH. Yan. So minamessage ko sila, doktora doon, na may papuntahin akong transgender man para at least hindi magulat na bakit may lalaking papasok sa gynecology unit. Then we refer for mental health professionals since may plan si Brix na mag-undergo ng surgery. Okay? Kung willing siya magpatingin agad. But so far, pwede kong i-assess yung cognitive capacity niya. Okay? And then immunization as well. Then monitoring niya for him is BP diary to establish kung talaga bang hypertensive siya. Or baka naman ano lang ito, no, white collar hypertension. Na-stress lang siya sa akin. Okay? And then body hair scale para ma-assess ko yung virilization. Kasi baka mamaya karamihan kasi sa kanila underdose so hindi pa nila nakikita yung mga changes agad. Or yung iba naman overdosing kaya sobrang they would manifest with very virile features and minsan mainitin ang ulo nila, irritable sila. Okay? And then of course, follow up every 3 months upon from the baseline. So we are able to provide both care for transgender women and transgender men. Kahit papagbaliktarin ko yung concern nila, whether si Brix yung mga ilangan ng antiretroviral therapy or si Victoria yung mag-a-access ng PrEP, the recommendations basically same lang din. Okay? So, Transhealth in summary, basically, we provide medical consultation, psychosocial support, kahit simpleng pakikinig sa kanilang struggles during their transition. That's already a form of psychosocial support in a very non-discriminating environment. Then for labs, yung mga pertinent labs na kailangan lang since kadalasan costly ito for them. And then, of course, monitoring, not just yung mga labs ang minomonitor, but the physical changes para malaman natin kung anong need i-tweak or anong need i-adjust. And of course, pwede rin kasi magbago yung kanilang goals in terms of transitioning. So, dapat yun, update natin para mas nag-guide din natin ano pang kailangan nila. And then basically, annual primary care, sexual and reproductive health kasama din, cancer screening, especially kung long-term clients na sila. And then of course, kung nag-undergo sila ng surgery outside my service, then at least man lang meron akong updated anatomical census. So, medyo mahirap i-crump ang transgender health in 30 minutes, but hopefully ang pinaka gusto ko maiuwi nyo for today are etong mga to. No? So, if you really want to be an ally in terms of transgender health or transgender concerns, as medical providers, we should be able to provide trans health services. Okay, hindi man sa atin sa ngayon, no, kung hindi pa tayo capable makapag-provide nito dahil dinedevelop pa lang natin, at least know where and how to refer. But I also like to introduce na lang din yung PPAT. So currently, we just recently established yung Philippine Professional Association for Transgender Health. We were launched in November, pero officially nakakapag-SEC registry this year. So medyo struggle. So bago-bago pa lang naman po kami, baby pa. So, ang goal naman namin is to have a local society wherein from different specialties, no? Hindi lang doctors, psychologists, psychiatrists, even yung ating mga friends, especially the community, no? Students, pwede silang sumali. no? Kasi ang goal natin is to provide healthcare for transgender and gender diverse people na compassionate and evidence-based. Syempre yung effective talaga. And of course, culturally appropriate healthcare. So sa Philippines pala ang lawak ng ating kultura, no? So may iba-iba tayong lengguwahe kada region. So ang gusto natin is lahat may access to such healthcare. Okay? That way, we'll be able to provide health equity and equality for all. And so sa ngayon, medyo limited pa kami ng mga activities but nagsisimula na kami. If you want to be updated no, sa mga paparating na activities, you can check us at Facebook. We also have a website, the ppat.org. And you can also be a member. For now, free naman po yung membership. No? So para lang at least directly namin kayo masendan ng updates, especially pag may upcoming trainings, especially sa mga nagtatanong kung may upcoming training. So we're working on that as well. Okay. So with that, I'd like to thank everyone for giving me time to discuss or to introduce transgender health.